Welcome to the Delayed Project Intervention Process Overview. The purpose of this session is to review document development target dates and describe the intervention process and its implementation. A CLSI document's value is reflected in the accuracy of contents, quality of writing, and practical application of the information contained. The Document Development Committee is responsible for producing a new or revised draft document that has all of the following attributes. Complete. With respect to the content outline or flow chart approved in the project proposal. Correct. With accurate technical content, accurately stated reflections of requirements versus guidance, and reference facts. Current. With respect to the available level of information. And compliant. With the writing requirements provided in CLSI writing instructions. To ensure the CLSI document is current and delivered in a timely manner, target dates for each milestone in the document development process are established upon project authorization. Target dates are continuously monitored by staff and confirmed throughout the project's development. They are reviewed by the responsible expert panel periodically and the Consensus Council quarterly. To assist document development committees, expert panels, and Consensus Council with progress monitoring, CLSI developed tracker dashboards. These tools are intended to provide a snapshot of projects in progress, as well as details about each project. While committees strive to complete document development in a timely manner, there are several factors that can contribute to delays such as volunteer availability, difficulty reaching consensus, inclusion of highly technical details, and so on. The current timeline goal from time and development to document publication is set at 25.5 months, with significant delays occurring at the time and development phase. Currently, on average, the time spent in document development is 25 months versus a goal of 14 months. While the average may not seem significant, delays in development create notable downstream effects resulting in a need to shift timelines, document priorities, publication projections, and staff resource allocations for the late document as well as other documents. To address significantly delayed projects, the Delayed Project Intervention Process was developed. This process allows for examination of delays, confirmation of commitment to continue document development on the part of the Document Development Committee, and presentation of a recommendation for next action. Milestone 3 is the point of initiation for the Delayed Project Intervention Process. When the Milestone 3 target date is exceeded, that is, the committee draft review has not been started within 13 months of the Document Development Committee's inaugural meeting, the Delayed Project Notification is issued by CLSI. This notification is sent to the Document Development Committee and the expert panel chairholders and vice chairholders. Upon receipt of the Notice of Delayed Project, the expert panel leadership requests an update on the project's status from the Document Development Committee's chairholder and vice chairholder. The expert panel may request information on the Document Development Committee members' attendance at meetings, and the status of writing assignments for document content development to help determine if changes to the committee's membership are warranted, and whether changes to the document's scope should be included as part of a plan to get the project back on track. In consultation with the expert panel leadership, the Document Development Committee chairholder and vice chairholder develop a recommendation. This recommendation could be for project cancellation or a request for extension. If a request for extension, a project plan should be developed to outline activities required to complete the committee draft and provide guidance on how the activities will be completed, by whom, and when. The Delayed Project recommendation is submitted by the Document Development Committee leadership using the Delayed Project Intervention Form. Access to the form is provided in the Notice of Delayed Project Communication. It is important to note, the Document Development Committee chairholder and vice chairholder must submit the completed form within 14 calendar days of distribution of the Delayed Project notification, or the project will be canceled. If the Document Development Committee leadership wishes to discuss its recommendation with Consensus Council, a meeting will be scheduled. Once received, the recommendation is considered by Consensus Council during a pre-scheduled monthly meeting, unless the Document Development Committee leadership submits a request to present the recommendation to Council during a meeting. In this case, efforts will be made to schedule the presentation at Council's next monthly meeting. When reviewing the recommendation, Council considers Whether plan changes will result in the delivery of a committee draft within the extension time granted, or if an alternate solution can or should be sought. The project's continued relevance to the market. The Document Development Committee's affirmation of willingness to continue on the project. The Document Development Committee chairholders and vice chairholders' willingness to continue leading the project. And the expert panel leadership's agreement with the recommended action. Then, Consensus Council determines the next action. Actions include granting an extension to continue document development, canceling the project, determining another option as deemed appropriate. It should be noted that no more than one extension will be granted. Once Council's decision on the recommendation is made, the Document Development Committee and expert panel are informed. When an extension is granted and a project fails to reach the committee draft review stage, that is, milestone 3, within the allotted time frame, the project is canceled. The Document Development Committee and expert panel are informed about the cancellation. If the document was undergoing revision, Consensus Council, in consultation with the responsible expert panel, will determine the next action for the last published version of the document. Please direct any questions you may have about the delayed project intervention process to Jennifer Adams, Vice President of Standards and Quality, at jadams@clsi.org. Thank you for acknowledging the importance of timely standards development and for your continued commitment to CLSI's success in furthering its mission to develop clinical and laboratory practices and promote their use worldwide.